Some protective factors, you involved in alternative activities so that you don't focus on these addictions. Good message for the boys, also for the girls, because we are dealing with this every day, what is happening in the hostels and all that, and the campus and all the outside the campus. Don't involve in that. You start involved. If your room partner is with that, remove him. And the good question that I've seen in the, and I still get laughter with that. In Munnabai MBBS, the person who was, what is the procedure to change the room? How innocently he has asked, because Munnabai was his partner. So you can do also that thing. We are there to help you, to tell these people who are involved in this, because I should not tell in the forum and I should not tell the names also, because this is going on live. We are uploading this video on YouTube also. Students have lost their lives. If you talk with your seniors, they will tell you the names and tell you they lost their lives. One student, after admitting in the first MBBS, within 2 months, he lost his life because of this addiction. He met with an accident because of high alcohol content. We cannot disclose to anyone. At that time, we were serious. A person who got admitted within 2 months back, and he started using this alcohol. That is not easy. Your parents, they are worried about you. They have paid heavy fees and came here. You came here because of them. You should remember them. There are other ways you can find. You can make high. I don't mind if a student is making some years and as and in the hostels and all that. Because I was also a student. I have done these things. Discipline is there. But doing this thing is very bad. So my message is to please avoid this thing. Sense of well-being, self-confidence, positive future plans. सोचो क्या करना है मुझे. This is not your aim. Dopamine अभी high कम हो गया आपका. Admission already हो गया. Now dopamine is high with your first MBBS. कब मुझे result आएगा? कब मुझे marks मिलेंगे? कब मैं first MBBS, second MBBS, third MBBS, then PG and then super specialty and my hospital and my put this aims, never ending aims. एम्स खत्म हो गए, लाइफ खत्म हो गई. कोपिंग स्ट्रैटेजीज सबको मालूम है. मुझे मेरा कोपिंग स्ट्रैटेजीज क्या है. व्हेन आई गेट स्ट्रेस, मुझे क्या करना है, बिकॉज इन द नेट यू ऑब्जर्व आल्सो दैट थिंग. मुझे स्ट्रेस आया तो मैंने क्या किया. आई गॉन आउटसाइड, आई टॉक्ड विद माई पीपल, आई टॉक्ड विद माई मदर, टॉक्ड विद माई फ्रेंड, टॉक्ड विद माई फादर, टॉक्ड विद माई ब्रदर, माई कजिन. आई टॉक्ड एंड आई रिलीव्ड माई स्ट्रेस. सो यू हैव टू डू दिस थिंग. देन ओनली, because we don't, the mentors are there, teachers are there, but we can't help every time. You have to build your coping strategies. The attitude towards learning. करना है, सीखना है, कुछ भी अच्छा. आज भी अभी I am saying this 200 faces here. Still some people they are losing their, उसका नीचे सर है, क्या कर रहा है, वो बात कर रहा है, ये कर रहा है. I don't bother about this. My focus is with this. In this 200, if 50 students, they are positive with this and if they're taking my message, I'm satisfied. I feel happy. My dopamine is released. I'm not bothered about this person who's talking here and who is doing. I know what will the future of this person. I can talk, I can see, because I've taught almost 23 batches of MBBS. Many students, they are taught, they are now PGs and they are super specialty and now they are doing good practice also. जब substance abuse, इसके लिए सब ये सब किया आज मैंने. यूज करने के लिए नहीं, आपको नॉलेज होना चाहिए कि ये कर रहा है तो that is bad. Because we came from the family. मुझे भी नहीं मालूम था. When I came to medical, I was also knowing what is liquor and what is this ganja and what is bhang and all that. I came to know from my seniors, from my friends and all that. मैंने पहली बार देखा. Culture doesn't allow this. This of this drugs and addiction is very important. Should have negative attitude towards this addiction. ये सब ऐसा नहीं है, ऐसा फिल्मों में दिखाते हैं ना, अभी फिल्मों में भी ज़्यादा है, लाइन आती है नीचे, इंजुरीज टू हेल्थ, बट वी फील गुड कि एक स्मोकिंग कर रहा है, यूजुअली दिखाते हैं वो विलन्स एंड ऑल दैट, एंड यू फॉलो दैट. जैसे KGF की एंट्री होती है, KGF उसका रॉकी 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 म्यूजिक एंड ऑल दैट, वी फील गुड दैट. बट रियल लाइफ में ऐसा होता नहीं है. नो वन प्लेज म्यूजिक फॉर अस एंड नो वन सेज दैट यू आर वेरी गुड एंड ऑल दैट, नो वन अप्रिशिएट यू. ऐसा कुछ नहीं होता रियल लाइफ में. गुड फ्रेंड्स, it's a very good coping strategy. The same line I'm coming here also. Good friends, talk with them, have a good company, relieve your stress. If this is done, the incident has not happened 2 days back. You must be aware of that. So you should build your own coping strategies that will help you. If you not, come to the teachers, come to the mentors. There are counselors, there are psychiatrists, there is a psychiatrist in our hospital. Ending your life is not a solution. Kayarta collection hai. I was talking with my friend someday, 2 days back only, and we were talking in the line that during our time, does we feel stressed? He said no. So why we didn't feel? Because इतना प्रेशर नहीं था हमारे तरफ. वी यूज्ड टू गेट फेल, नो प्रॉब्लम, चलो अगली बार का पास हो जाएंगे, नो प्रॉब्लम. ऐसा कुछ. उसने और एक चीज़ मुझे बताई, अरे अपने एटीट्यूड से लोगों को स्ट्रेस हुआ होगा और लोगों ने सुसाइड की होगी. दिस शुड बी योर एटीट्यूड. अपना एटीट्यूड ऐसा नहीं होना चाहिए कि उसकी वजह से यार मैं. एंड वेरी गुड इंपॉर्टेंट मैसेज आई एम टेलिंग टू एवरी वन हियर, ऑल दिस 200 स्टूडेंट्स. मेरा पार्टनर बहुत पढ़ रहा है, वो रात रात को उठ के कुछ बोन उठा के लेके पढ़ रहा है. एंड यार मैंने चादर के नीचे से देखा, वो तो कुछ तो बरमत कर रहा है. एंड आई एम स्लीपिंग एंड आई एम what will happen? You get depressed. अरे उसका स्ट्रेटेजी अलग है, मेरा स्ट्रेटेजी अलग है. आई वेक अप इन द मॉर्निंग, आई स्टार्ट, मुझे याद रहता है, आई विल नॉट कंपेयर विथ हिम. बहुत सारा स्टूडियस हो, टॉपर आता है. अभी there is a difference in the scores also. I had seen your topper is 574. 574 is the topper, and I don't want to talk about what is the lowest. Difference is there. No student is same. कुछ प्रॉब्लम नहीं है. एक बार फेल हुए, 2 बार फेल हुए. The government has allowed 4 attempts. 4 अटेम्प्ट मैं बोलता नहीं कि 4 अटेम्प्ट दो. But if you feel stressed, positive thing is that there are 4 attempts. बहुत बढ़िया है. सब्जेक्ट कितने फर्स्ट ईयर में मालूम है? एक सब्जेक्ट एक अटेम्प्ट में दिया तो भी एक अटेम्प्ट बच जाता है. दिस शुड बी योर एटीट्यूड. अरे सर तो कल परसों लेक्चर में बोल रहे थे कि मेरे डिपार्टमेंट में इतने डिस्टिंक्शन आए, इतने आ रहा है. सर तो बोल रहे थे एक एक अटेम्प्ट, एक एक सब्जेक्ट दे दो. This is all different. This is talking with you people. This was for your parents. They should feel that कि मेरा बच्चा distinction में आएगा. But that doesn't mean they will pressurize you for distinction. They will be happy if you pass. The main, I was talking with that day we had a good meeting because of that incident, and management was talking with us. And that day they said, when you go in, you observe, when you go in a clinic, any hospital, big hospital, take a corporate hospital also, see in his OPD, and what is there in his chamber? What is there? Government has make it compulsory. You have to put your degree certificates. Observe करो उसमें डिग्री सर्टिफिकेट MBBS का है, MD का है, DMA, कार्डियोलॉजी, MCH है, DM कुछ भी हो, MCH होने दो. In that certificate, that degree certificate or registration of councils doesn't mention your marks. It doesn't mention your grade. It doesn't mention your attempts. Then what is the meaning of fighting with that? वो यूनिवर्सिटी नहीं चाहती तुम्हारे अटेम्प्ट दीवार पे लटके. यूनिवर्सिटी नहीं चाहती कि तुम कौन से ग्रेड में आए. तो why you are bothered? My aim is to pass this MBBS degree. And I have seen, मैं कुछ बच्चों को उधर बताना चाहता हूँ, the students who have failed subsequently for 2, 3 attempts, 4 attempts, they are having a very good practice also. क्यों? प्रैक्टिस उनकी क्यों अच्छी है? एक साल एक ईयर 2 साल करेगा, बेस अच्छा हो गया उसका. They are having very good knowledge, they are having good social relations because they got time, they have friends. This is not your part, but just I'll highlight psychotherapy, medication, behavior, hospitalization, support groups. The strategies are there. If you have it in a trap and if you're feeling that I am depressed, I am anxiety, I am stressed, I am addicted, I am not feeling better, I am not getting what I am feeling. It is not depression, it is not anxiety, it is not stress. I don't know what is feeling, but I am feeling bored. Just talk with your counselor, talk with your doctor, talk with your mentor. This is my trust. We do these activities, addiction awareness, addiction prevention, addiction treatment, online counselings, depression, stress, the treatment, the trainings, the programmings. This is my de-addiction center which was there in the Nasik, and we admit these patients of addictions. I have the patients from age 12 till 75, 78. See the range, 12, 78. And they are in that rehab centers. And my rehab center is always full. I don't have to find patients because there are a lot of patients in the society. These are some activities we give for our patients. They do some, so that, because khali dimag shaitan, so we keep them engaged because they are with us for 30 days. Residential treatment hai. This was news in the Ahmednagar newspaper. I am talking, this was in 2018. And they have published in the front page under the heading Sunday positive. This was booster for some, they thought this is a booster for some people, and they are published with this article and how many patients we have treated and all that. This is my website. You can find out everything in that website, what we do, what we do. You can connect with me if you have any that social interest. You can connect with me, we'll find, and we can get involved with this activity also. This is helpline number. This is for not only for addiction people. This is helpline number for counseling. If you need any online counseling, this number, you dial this number, ask for a help, we'll get and help with these numbers. We have counselors, they talk with you, they will make free. Don't feel that Dr. Patil will be talking with you. And how can I reveal my secrets with Dr. Patil? Because he is there in the second year. So my counselors they keep this topic very secret. They never reveal, because this is the rule of counseling. We never disclose anything to the parents also. So easiest way to connect by dialing this helpline number. If you want to note down this number and have this, or go in the website, you will find my numbers also. I hope that you take at least one thing away from today. Addiction is a subject that most people would rather not discuss because of social stigma. My patients also, when they come to my clinic or my centers, they hide here and there and then come. Or at the night they come to get admitted because of social stigma. The more knowledge you have, the safer your life will be. So last message to this audience, just say no loudly. No means no. Very good. Thank you.